Back at home, a study by the Singapore General Hospital has found that reviewing antibiotic prescriptions within 24 hours could help prevent the overprescription of antibiotics. The hospital stops antibiotic prescriptions for patients who do not display evidence of a bacterial infection within 24 hours.
SGH is currently the only hospital in Singapore which has adopted a 24-hour review. The study also found it's safe to stop antibiotic treatment if there's no strong evidence of bacterial infection, even before test results are available. And patients who follow recommendations to stop medication within a day had their stay in the hospital reduced by as much as a week.
The study is based on data from 12,000 cases over 5 years, starting in 2010. According to SGH, the overuse and misuse of antibiotics leads to bacteria becoming more resistant. As a result, once easily treatable illnesses such as urinary tract infections become difficult to treat.
And here to tell us more are Dr. Andrea Kwa, Assistant Director of Research at the Department of Pharmacy at SGH.
And Dr. Jasmine Chung, Consultant at the Department of Infectious Diseases at SGH as well. Dr. Chung, I'll come to you first. We know that antibiotic resistance from overprescribing, over-consuming as well is a growing concern. But how big of a concern is it here in Singapore?
It is actually a very relevant problem. For example, the urinary tract infection, the bacterial that commonly causes urinary tract infection, resistance rates are as high as 30% of commonly used antibiotics. Yeah. And within the hospital setting of the audited antibiotics that we are reviewing, resistance rates are as high as 25% in some very virulent pathogens. So it is a growing problem in Singapore. It's something that we need to keep our eyes on.
So do we see the abuse of antibiotics more in hospitals or in outpatient clinics?
It is both. It happens both in the community and in the hospital, what we are describing is antibiotic use in the hospital setting. For example, if patients go to the general practitioner with a respiratory tract infection, antibiotics are often prescribed for a viral infection, and that is an example of a common misuse of antibiotics happening in the community.
And Dr. Kwa, do the benefits and safety of early antibiotics review differ across different demographics?
Not really, because in our study, most of the patients who come into Singapore General Hospital is about the age of 60. So you don't really see youngsters coming into SGH because, you know, it's acute care tertiary hospital. So usually these people who come in tend to have more comorbidities. So we don't really see that kind of differences across different demographics. Yeah.
Dr. Kwa, so not all physicians actually accept the antibiotic stewardship program recommendations. Question is, why is that, and when is it actually necessary to maintain usage of antibiotics?
All right. Okay. When we first started this antimicrobial stewardship program, we always maintained that the primary team physicians has the final autonomy because we come in from objective point of view, whereas they have the subjective point of view because of their clinical assessment of the patient at an intimate manner. So we do, if they refuse to stop, there are certain reasons that we may not be privy to. We allow them because in this way, it is like a partnership between us and the primary team. Is like a multidisciplinary team coming in together to actually nudge each other along to make sure that the antimicrobial prescribing is actually appropriate.
Okay, and when, in regards to sort of this review, how does it address then the problem of overprescription of antibiotics and sort of at the local healthcare level?
It shows us that it is a problem, but actually the review also gives us confidence to discontinue antibiotics in a select group of patients as described in the study. So, for example, patients with rapid recovery, reassuring laboratory test, it's safe to stop antibiotics before culture results are back.
So then help us understand, because whenever you go to a doctor, they say you have to finish the entire course of the antibiotics for it to be effective. But now you're telling us it's okay to stop halfway or at the beginning. Just clarify that.
So to clarify that issue, antibiotics are used for bacterial infections. It's not going to work for viral infections. So I like to think of things simply. A 3-point rule is golden. If there is a bacterial infection, use it. If there's no bacterial infection, stop it. If there is a true bacterial infection, then you can use a more narrow spectrum antibiotic, switch.
Okay, so which means if you know that you don't have a bacterial infection, then you can just stop it anytime. The antibiotic actually doesn't do any harm to you.
That's right, yes.
Okay, so Better understanding. Dr. Kwa, what needs to be done to ensure that the ASP is actually scalable on a nationwide level, though?
Actually, we do have ASP at all the public healthcare institutions already. So it's already scaled to the maximum level that we have. But right now, the manpower that we have is not enough to audit every cases of antibiotics. So to do that, we need maybe augmented intelligence and more sophisticated tools to help us. So going forward, what we can do is continue education to our primary prescribers, work together with them to make sure that their antimicrobial prescribing is appropriate, and we do guide them that if you need to stop the antibiotics earlier, because if the patient doesn't really need it at that point in time, we try to persuade them to stop with us.
Okay, and what would be the other sort of key recommendations for fellow medical practitioners?
Prescribe wisely, optimize outcomes for today, steward for the future. I think it's very important for us to not just think for locally and for today, but really thinking long term and for future generations.
For our next generations, yeah.
Yeah, okay, well, thank you both so much for coming in and speaking with us. Dr. Andrea Kwa and Dr. Jasmine Chung from SGH.
Thank you very much.